A.
D for dog.
D for dog, that's right. Proteinuria, it is. C. Nephrotic syndrome. D. That's right. Next question. 24 months history of right jaw swelling, progressively increasing in size, associated but not jaundiced or cyanosed. Vital signs were unremarkable. Local examination, a mass involving the right jaw, measuring about 9 centimeters greatest diameter, fixed to the underlying structures, firm in consistency and non-tender. The abdomen was asymmetrically distended, moving with respiration, negative fluid thrill. The spleen and the liver were palpable, 10 centimeters and 8 centimeters below the costal margins, respectively. Circle the most likely diagnosis. A. Rhabdomyosarcoma. B. Burkitt's lymphoma, stage 4. C. Diffuse large B-cell lymphoma, stage 3. And D. Follicular lymphoma, stage 4.
B for boy.
Fantastic. That's right. Thank you very much. Well done, Group C. Group D. Yes, Group D.
Question 2.
2,
10,
10,
22,
22,
5,
5,
and 12.
and 12. Okay. Question 2. Is the process which involves medial obliteration of the pleural cavity. A. Thoracocentesis. B. Pleurodesis. C. Amniocentesis. D. Pneumonectomy. E. Tracheostomy.
B.
B for boy. That's right. Question 10. A 26-year-old female presented with a 4-month history of shortness of breath, especially on exercise, associated with fatigability, lethargy, and palpation. On examination, the patient was severely anemic, but not jaundiced or cyanosed. There was koilonychia, and the CBC revealed a hemoglobin of 6 grams per deciliter, MCV of 78 femtoliters. Which of the following is the correct diagnosis? A. Anemia of chronic disorders. B. Hemolytic anemia. C. Iron deficiency anemia. And D. Megaloblastic anemia.
C. Cut.
C for cat. That's right. Next. 22. Atherosclerotic plaques contain all of the following principal components except A. Cells such as the smooth muscle cells, hemosiderin, laden macrophages, and the multinucleated giant cells. B. ECM such as and including collagen, elastic fibers, and proteoglycans. C. Intracellular and extracellular lipids. And D. A fibrous cap.
B.
B for boy. That's wrong. Size A. Next question. Number 5. The commonest lymphoma in the pediatric population. A. Chronic cell lymphoma or leukemia. B. Follicular lymphoma. C. Diffuse large B-cell lymphoma. D. Mantle cell lymphoma. And E. Hodgkin's lymphoma.
A.
E for egg. That's right. Lastly, number 12 is a sprouting and exacerbated fibroproliferation of tissue. A, tumor. B, keloid. C, callus. D, osteoid. And E, epithelium. B for boy. Fantastic. That's right. Well done, groups A, B, C, D. There's a group with a concern. I think you can come forward and get the mic. MC, move to the podium and get the mic. The group with a concern.
Number 4, pathology. Usually they tell us that if you want to excel in objectives, sometimes use exclusion, isn't it? And question number 4, we have 2 answers that are actually correct, and they are quite misleading to us. That is option B and option E. We thought they would be the answers, but because there were them, we had to use the challenge of exclusion. Thank you. So we request for another number in compensation for that. Thank you.
You're saying B and E are correct. So for you gave which letter? Eh? You gave D. You said B and E. You gave D.
Like I said, passing objectives sometimes use exclusion. And for we had to choose that one because 2 answers were correct, yet it was our option would have picked. Thank you so much.
I think if you had selected one of the right answers, I think it would have carried more water. My co-moderator, John Francis Abongoto, President Emeritus. How should we proceed?
Yes, Master.
Okay. Yeah, the co-moderator said we give them another question. Okay. No, you don't have like a say. Probably, let's. It would have been the quiz master to decide this, but in the absence of the quiz master, I will take the consensus of the moderators. Let me just get to one more moderator. Yes. How should we proceed? Okay. Yeah, according to the consensus of the moderators, they say we give them another question. Okay. Choose a question.
We don't know the unselected ones.
Yes. You choose. I'm going to check here. Eight has been selected. Okay, probably. Let me see.
5.
5 was selected. 20. Okay. 20. Yeah. 21 was not selected. Let you people take 21, eh? Yeah.
Okay.
So, with the exception of one, All of the following statements regarding the Nelson syndrome are correct. A, it's caused by surgical removal of adrenal glands for treatment of the Cushing syndrome. B, presence of large destructive pituitary adenoma is typical. C, radiographic abnormalities of the sellar and the bitemporal hemianopsia is a dominant feature. D, hypercortisolism and hyperpigmentation is commonly observed.
D.
Pardon? D for dog, that's right. Thank you. We are going to go to pharmacology. Shall start with group D. You can be selecting your questions. Probably just info. So in case of any issue that pops up, due to the absence of the quizmaster, we shall take the consensus of the moderators. Yes? And their decision will be final, even if unfair. Yes. Group D, farm, your numbers.
1,
1,
5,
5,
4,
4,
8,
8,
19.
19. Okay. Question 1. A 22-year-old woman suffering from asthma was prescribed albuterol by inhalation. Albuterol is a bronchodilating drug with a molecular weight of 239 daltons. Which of the following permeation processes most likely accounted for the transfer of the drug through the bronchial mucosa? A, aqueous diffusion. B, lipid diffusion. C, facilitated diffusion. D, endocytosis. E, active transport.
B.
B for boy. Okay, that's right. Number 5. An 85-year-old man was recently admitted to a nursing facility. Diseases listed in his medical record on admission were depression with anxiety symptoms, atrial fibrillation, chronic obstructive pulmonary disease, and osteoarthritis. Medications taken orally by the patient included the following: sertraline, base pKa 9.5, diazepam, it's a base pKa 3.0, amiodarone, it's a base pKa 7.4, theophylline acid pKa 8.8, ibuprofen acid pKa 4.8. Shortly after administration, which of the following drugs was most likely concentrated inside the patient's gastric cells? A. Sertraline. B. Diazepam. C. Amiodarone. D. Theophylline. E. Ibuprofen.
E.
E for egg. That's right. Next question is question 4. A 45-year-old man suffering from epilepsy had been receiving carbamazepine, 1 tablet daily. The drug has a total clearance of 63 liters per hour and a hepatic clearance of 62 liters per hour. The man was recently diagnosed with a skin infection due to Mycobacterium marinum, and treatment with rifampin and ethambutol was started. Knowing that rifampin is a potent inducer of microsomal enzymes, which of the following changes most likely occurred to the pharmacokinetics of carbamazepine? A. The hepatic clearance of the drugs decreased. B. The fast pass loss of the drug decreased. C. The renal clearance of the drug decreased. D. The volume of distribution of the drug increased. And E. The half-life of the drug decreased.
E.
E for egg. That's right. Members, when you're giving your answers, add a letter, add the words. Apple, boy.
E for
Okay.
Entebbe.
8. Next question is question 8. A 14-year-old boy with type 1 diabetes noticed symptoms of palpitations, inward trembling, sweating, hunger, weakness, and nervousness just after his participation in a basketball game. His medication included twice daily injections of insulin. Most of the boy's symptoms likely resulted from increased firing of which of the following neurons? A. Somatic motor neurons. B. Pyramidal neurons. C. Preganglionic parasympathetic neurons. D. Preganglionic sympathetic neurons. E. Postganglionic parasympathetic neurons.
D for dog.
D for dog. Fantastic. That's right. Next question is question 19. A 63-year-old man recently diagnosed with stage 1 essential hypertension started a treatment with hydrochlorothiazide. After several weeks of treatment, the antihypertensive action of the drug was most likely associated with which of the following effects? A. Remarkable postural hypotension. B. Decreased cardiac output. C. Decreased peripheral vascular resistance. D. Increased interstitial fluid volume. And E. Decreased renal blood flow.
B for boy.
B for boy. That's wrong. The answer is C. Well done, Group D. A round of applause to Group D members. Group C.
Eighteen,
18,
22,
22,
24,
24,
28,
28,
and 30.
and 30. Okay. Question 30. Which antibiotic is commonly used for treating methicillin-resistant Staphylococcus aureus infections? A. Amoxicillin. B. Ceftriaxone. C. Vancomycin. D. Linezolid. E. Doxycycline.
C for cat.
C for cat. Vancomycin. That's right. Number 28. Which of the following drugs is most associated with dose-dependent neurotoxicity, specifically ototoxicity? A. Amikacin. B. Ciprofloxacin. C. Metoprolol. D. Chlorpromazine. And E. Chloroquine.
A for apple.
A for apple. That's right. 24. A 45-year-old woman complained to her physician that for the past month she had frequent episodes of developing a sudden feeling of warmth over her chest, accompanied by a patchy flushing of her skin. She stated that these symptoms were extremely disturbing. She had been having irregular menstrual periods for the past year, often skipping 2 or 3 periods at a time. Which of the following preparations would be most appropriate for short-term hormonal replacement therapy in this woman? A. Oral ethinyl estradiol. B. Transdermal estradiol. C. Oral norethindrone. D. Subcutaneous implant of levonorgestrel. E. Oral ethinyl estradiol norgestrel combination. And F. Parenteral medroxyprogesterone.
C for cat.
C for cat. That's wrong. The answer is E. Next question. Question 22. A 51-year-old woman suffering from chronic asthma was admitted to the hospital with nausea and vomiting, extreme restlessness, insomnia, tremors, mental confusion, and fever, 103.1 degrees Fahrenheit, 39.5 degrees centigrade. After her sister died a few days ago, she experienced increased hunger, dyspnea on exertion, palpitations, and diarrhea. Laboratory data on admission included a free thyroxine level of 11 nanograms per deciliter. Normal is 0.9 to 2.0 nanograms per deciliter, and undetectable thyroid stimulating hormone, TSH, thyrotropin levels. Which of the following drugs should be included in the emergency treatment of the patient? A. Diltiazem. B. Radioactive iodine. C. Triiodothyronine. D. Danazol. E. Propranolol. And F. Aspirin.
E for elephant.
E for elephant. That's wrong. The answer is A. Diltiazem. Next question. Question 18. A 63-year-old woman was found to have a 3rd-degree atrioventricular block. The woman, who had been suffering from stage C heart failure, had been receiving captopril, furosemide, and digoxin for 2 months, and the disease was well controlled. The physician believed that the block was due to digoxin therapy. Which of the following would be an appropriate therapeutic adjustment for this patient? A. Discontinue digoxin and start milrinone. B. Add physostigmine and decrease the digoxin dose. C. Add atropine and decrease the digoxin dose. And D. Discontinue digoxin and start metoprolol. E. Add dobutamine and decrease the digoxin dose. And F. Discontinue digoxin and start losartan.
D for dog.
Pardon?
D for dog.
D for dog. That's wrong. The answer is C. Well done, Group C.
Group C first weight. There has been a concern on number 28. Yes, the concern is on number 30. The question states, which antibiotic
The answer is vancomycin. However, on the answer section, vancomycin is given D, yet here it is C, but the answer is vancomycin.
according to the examiner, he clearly states that for methicillin-resistant Staphylococcus aureus, first line is linezolid. It's the best drug, and the option is actually linezolid, just that they put vancomycin.
Okay, let's calm down. Let's calm down. Let's calm down.
Actually, linezolid is vancomycin resistant.
Some brief communication.
So as we were informed earlier about this form, it's for our brother in year 5, Odukatum Polycarp, who is going to undergo a surgical operation in Mulago. So simply, we are going to pass this form. You can put your pledge. If you are pledging, you put pledge and then you put your phone number. But if you are giving cash, you can also give it right now. It's okay. It's circulating the form.
Group B, please. Take over. Yes, Group B.
Thank you so much, Mr. Mutiava.
Yes, sir.
29,
29,
9,
9,
13,
13,
15,
15,
11,
11. Number 11. A 42-year-old man recently diagnosed with generalized anxiety disorder had started a treatment with sertraline, but the drug caused some sexual dysfunction, and the psychiatrist decided to switch to a short course of alprazolam. Which of the following molecular actions on neuronal membranes most likely mediated the therapeutic effect of alprazolam in the patient's disorder? A. Decreased outward sodium current. B. Increased inward chloride current. C. Decreased outward potassium current. D. Increased inward calcium current. And E. Increased inward hydrogen current. Yes?
D for dog.
E, pardon?
D for dog.
D for dog. Okay, that's wrong. The answer is B. Next question. Number 15. A 49-year-old man diagnosed with inguinal hernia was prepared for surgery. Shortly after the initiation of general anesthesia with halothane and succinylcholine, the patient developed muscle rigidity, tachycardia, labile blood pressure, profuse diaphoresis, and a high fever of about 40.1 degrees Celsius. The anesthesia was discontinued at once, and the drug was administered by rapid intravenous push. Which of the following was most likely the mechanism of action of the administered drug? A. Activation of the GABA B receptors in the spinal cord. B. Blockade of the excitatory neurotransmitter release in the brain. C. Blockade of calcium channels in the skeletal muscle membrane. D. Blockade of calcium channels in the sarcoplasmic reticulum. E. Increased potassium conductance in the skeletal muscle membrane.
D for dog.
E.
D.
D for dog. That's right. Number 13. A 53-year-old man was brought to the emergency department after suffering a head injury that required immediate surgery. Local anesthesia was performed by a brachioplexus block. The surgeon estimated that the procedure should last about 3 hours. Which of the following local anesthetics would be most appropriate for this patient? A. Prilocaine. B. Procaine. C. Tetracaine. D. Benzocaine. And E. Cocaine.
D for dog.
Okay. D for dog. Okay, there's a glitch in 13. We are going to select another number, okay?
Okay.
Yeah? There's a glitch, that's it. Okay, let's first complete these numbers, then you'll select one more number. I'm really sorry for that, eh? Number 9, eh? A 15-year-old boy suffering from asthma routinely self-administered albuterol through a metered dose inhaler. Which of the following actions most likely contributed to the therapeutic efficacy of the drug in the patient's disorder? A. Increased microvascular permeability. B. decreased bronchial secretions, C, release of histamine from mast cells, D, increased residual respiratory volume, and E, increased mucociliary clearance.
B for boy.
B for boy, that's wrong. The answer is E. Then 29. In cases of methanol poisoning, which drug is commonly used as an antidote due to its ability to inhibit alcohol dehydrogenase? A, flumazenil. B, N-acetylcysteine. C, fomepizole. D, naloxone. E, disulfiram.
C for cat.
C for cat, fomepizole. That's right. So let's select a question.
Question number 6.
Question number
6.
6. A 54-year-old woman complained to her physician of palpitations, dry mouth, blurred vision, and constipation. The woman had a long history of endogenous depression and had recently started a new antidepressant therapy. The patient's symptoms most likely resulted from a blockade of which of the following pairs of receptors? A, alpha 1 and alpha 2. B, alpha 1 and beta 1. C, M2 and M3. D, beta 1 and beta 2. E, nicotinic muscular and beta 2.
E for egg.
E for egg.
Alpha.
That's wrong. The answer is C. Well done, Group B. Group A. Yes, you're welcome.
Number 2, 3, 10, 17, 25.
Pardon, 2,
2, 3,
3,
10,
10,
17,
17,
25.
25. Okay, number 2. A 51-year-old woman suffering from hyperthyroidism was administered an oral solution of radioactive iodine to destroy her thyroid gland. Which of the following permeation processes most likely accounted for the transfer of the drug across the thyroid cell membrane? A, active transport. B, lipid diffusion. C, facilitated diffusion. D, endocytosis. And E, aqueous diffusion.
A for A.
F for apple. That's right. Next question. Question 3. A 22-year-old woman was admitted to the emergency department after a car accident. The woman had extensive brain trauma and multiple fractures. She complained of severe pain, and the attending physician planned to administer morphine. The physician knew that the dose should be carefully titrated because the entry of morphine into the patient's CNS was most likely higher than normal. Which of the following factors is most likely to have increased morphine entry into the CNS of this patient? A, the high fast pass effect of the drug. B, the brain trauma of the patient. C, the young age of the patient. D, the low clearance of the drug. E, the high ionization of the drug.
B for boy.
B for boy, that's right. Question 10. A 43-year-old man recently diagnosed with a pheochromocytoma, an enlarged adrenal tumor, started treatment with a drug that can cause profound decrease in norepinephrine and epinephrine by blocking the fast rate limiting step in catecholamine biosynthesis. Which of the following enzymes was most likely inhibited by the drug? A, aromatic 1-amino acid decarboxylase. B, dopamine beta hydroxylase. C, tyrosine hydroxylase. D, phenyl ethanol amine methyltransferase. And E, monoamine oxidase.
C for cat.
C for cat. That's right. 17. A 55-year-old woman recently diagnosed with variant angina started treatment with isosobide mononitrate and diltiazem. Which of the following actions most likely mediated the therapeutic effect of nitrates in the patient's disease? A, increased left ventricular end diastolic volume. B, increased blood flow in the large epicardial vessels. C, increased heart rate. D, decreased diastolic perfusion time. E, increased cardiac contractility.
B for boy.
B for boy. That's right. Question 25. A 76-year-old man complained to his physician of muscle X. Further exams led to the diagnosis of vitamin D deficiency due to inadequate intake. A vitamin D supplementation was prescribed. Which of the following would be the most appropriate pharmacotherapy for this patient? A, cholecalciferol. B, calcitriol. C, teriparatide. D, cinacalcet. And E, calcitonin.
A for apple.
Fantastic. Yes, thank you very much, Group A and all the other groups. We are going to switch to the next microbiology. Group C. We shall have C, B, A, then D. Yes? Group C?
Questions 1,
Question 1,
5,
5,
7,
7,
9,
8,
9,
9,
and 12.
and 12. Okay. Question 1. The non-pathogenic species of genus Entomoeba that occurs commonly in the human mouth is A. E. coli, B. E. Hartmann, C. E. gingivalis, D. None.
D
D.
for dog.
D for dog. That's wrong. The answer is C. Next question is question 5. Gardia trophozoites exhibit a characteristic A teardrop shape, B, pear shape, C, flask shaped, D, both A and B.
B for
Pardon?
B for boy.
B for boy. That's wrong. The answer is D for dog. Number 7. Okay, number 7. Each of the following statements concerning Ascaris lumbricoides is correct except A. Ascaris lumbricoides is one of the largest nematodes. B. Ascaris lumbricoides can cause pneumonia. C. Both dogs and cats are intermediate hosts of Ascaris lumbricoids. D. Ascaris lumbricoids is transmitted by ingestion of eggs.
D for dog.
D for dog. The answer is C for cap. That's wrong. Number 9. Pigs or dogs are the source of human infection by each of the following parasites except A. Echinococcus granulosus, B. Ascaris lumbricoids, C. Tinea solium, D. Diphyllobothrium latam.
B for boy.
B for boy. Fantastic. That's right. Next is number 12. Which of the following gram-negative coccobacillus requires the X or the hemine factor for its growth? Factor 10. A. Neisseria gonorrhoeae. B. Bordetella pertussis. C. Haemophilus influenza. And D. Haemophilus ducreyi.
C for cat.
C for cat. That's wrong. The answer is D for dog. Thank you very much, Group C. Loud of applause for Group C. Group B. Group B.
Number 2,
Number 2,
number 3,
3,
number 4,
4,
number 8,
8,
number 10,
number 10. Okay, number 2. Protozoan parasites that require hematine obtained from blood hemoglobin for aerobic respiration are called A. Heteroxenus, B. Hemoflagellates, C. Both, D. None.
C.
C for cat. Okay, that's wrong. The answer is B. Number 3. What are the clinical clues associated with anaerobic infections? A false smelling discharge. B, abscess formation. C, occasionally formation of gas. And D, all the above.
D.
D for dog. That's right. All the above. Number 4. What anaerobic bacteria causes diarrhea and colitis? A, Clostridium difficile. B, Bacteroides fragilis. C, Fusobacterium. And D, Prevotella.
A.
A for apple. That's right. Okay, sorry. Next question is question 8. During the course of his hospital stay, a severely burned 60-year-old male develops a rapidly disseminating bacterial infection. Small gram-negative rods that are oxidase positive are cultured from green pus taken from the burned tissue. Which of the bacteria is likely to be the causative agent? A, Clostridium difficile. B, Bacteroides fragilis. C, Pseudomonas aeruginosa. And D, Prevotella.
C.
Let's come back and take our seats. Let's take our seats. We are resuming.
Okay. Group A, I think you've rested enough. Not like. Okay, Group A, take over.
Number 6.
Number 6,
18.
18,
20.
20,
19.
19,
22.
22. Yes, Group A, let's start with question 6. Upper respiratory tract infection is an acute inflammatory process that affects mucous membranes of the upper respiratory tract. It includes the following problems. A, rhinitis, also called coryza. B, pharyngitis. C, sinusitis. And D, all the above.
D for dog.
D for dog, that's right. Number 18. In the treatment of TB, induced optic neuropathy is associated with which of the drugs? A, pyrazinamide. B, ethambutol. C, isoniazid. And D, rifampin.
B for boy.
B for boy, that's right. Question 20. You have a patient who makes autoantibodies against his own red blood cells, leading to hemolysis. Which of the following reactions is responsible for the hemolysis? A, antibody IgE-mediated reaction. B, type 1 hypersensitivity reaction. C, type 2 hypersensitivity reaction. And D, type 3 hypersensitivity reaction.
C for cat.
C for cat, that's right. Number 19. Extensively drug-resistant tuberculosis is defined as MDR-TB with resistance to isoniazid. B, MDR-TB with resistance to fluoroquinolones, e.g. moxifloxacin, plus resistance to one of the second-line aminoglycosides, e.g. kanamycin. C, MDR-TB with resistance to both ethambutol and streptomycin. D, Mycobacteria tuberculosis complex.
B for boy.
D,
B.
B for boy. That's right. Number 22. A 3-year-old child presents at the physician's office with symptoms of coryza, conjunctivitis, low-grade fever, and the Koplik spots. The causative agent for this disease belongs to which group of viruses? A, adenovirus. B, herpes virus. C, picornavirus. And D, paramyxovirus.
D for dog.
D for dog. Fantastic. Well done, Group A. Group D. Yes?
Yes.
Okay.
28,
28,
11,
11,
13,
13,
15,
15,
21.
21. Okay. 28. 2 yeasts, Candida albicans and Cryptococcus neoformans, cause disease in immunocompromised patients. They are biochemically differentiated from each other using A, the Gram stain, B, culture characteristics, C, production of urease, D, the Ziehl-Neelsen stain.
C.
C for cat. That's right. 11. The example of fishbone zoonosis is A, Diphyllobothrium latam, B, Toxocara canis, C, Toxoplasma gondii, D, all of these.
Diphyllobothrium latam.
Diphyllobothrium latam. Fantastic. That's right. 13. Which of the following bacteria is an obligate aerobe? A highly contagious pathogen that may cause serious respiratory infections in young children. A, Haemophilus ducreyi. B, Francisella tularensis. C, Bordetella pertussis. And D, Haemophilus parainfluenzae.
C for cat.
C for cat. That's right. Number 15. Expert MTB stroke reef molecular method is used. A, to detect resistance only. B, to detect resistance. C, to detect mycobacteria and rifampicin resistance. D, to confirm the MTB complex. And E, to do culture and sensitivity.
C for cat.
C for cat. That's right. 21. Although the fetus as an allograft is protected against rejection by the mother, some fetal red blood cells leak into the mother, particularly at the time of delivery. If there is an antigenic difference between the mother and the fetus, this red blood cell leakage might sensitize the mother to future pregnancies. This response could be directed against which of the following antigens? A, MHC class 1 antigens only. B, MHC class 1 and 2 antigens. C, rhesus antigens. D, MHC class 2 antigens only.
C.
C for cat. That's right. Fantastic. Group D. Thank you very much. Yes, I think the next moderator can take over.
At this juncture, we shall get an update from the score recorder about how the different teams are doing. The score recorder requests for some few minutes. So I think we can take on clinicals as of now.
Yes, the results for the preclinicals. Group A, you had 25 plus 25 plus 25, which total to 75. Group B, you had 20 plus 10 plus 10, which total to 40. Group C, this group, they had two issues with two questions, and only one question was given an answer. The other one, are we going to give them an answer? The one for trovozoids or wasporozoids? That one was rejected. Okay, they had 10 plus 25 plus 10, we total to 45. Then group D, they had 20 plus 20 plus 25, we total to 65. So the total for biomedicals plus clinicals, for group A, you have 130. Group B, you have 95. Group C, you have 110. And group D, you have 95. Thank you.
Good evening, members. We are heading into clinicals. In these clinicals, we are going to be having a bit fewer questions. So each group will choose 4 questions. That is from number 1 up to 20. So you choose 4 questions, each group. So we are going to start with A. We are going to start with internal medicine. So, group A, can you step forward? So you are allowed to choose from number 1 up to number 20. You'll have only 1 minute to do so because we don't have time.
Number 5, number 6.
Number 5, number 6.
Number 8.
Number 8.
Number 18.
Number 18. Please confirm these are the numbers you want. Number 5, number 6, number 8, and number 18. So we are going to start with number 5. Number 5. A 25-year-old man presents to the emergency department, that is ED, with central chest pain, tachycardia, and excessive sweating. He admits that he was at a party and were given some suspicious powder, possibly cocaine. The question: what is your most likely diagnosis? A, coronary artery vasospasm, thoracic aortic dissection, esophageal spasm, pericarditis, and pneumothorax.
Option A.
Option A for
apple.
For apple. Option A is the correct answer. How do you get that? Yeah. Question number 6. A 63-year-old man is brought to the emergency department with severe chest pain, He described the pain to be radiating through to his back. Is a long-term smoker and is being treated for hypertension. What is the most likely diagnosis? A, coronary artery vasospasm. B, thoracic aortic dissection. C, costochondritis. D, esophageal spasm. E, pericarditis. F, pneumothorax. G, pulmonary embolism. Group A.
Option E for egg.
E for what?
Option E for egg.
Option E for egg, unfortunately, is not the correct answer. The answer is B. That is thoracic aortic dissection. Number 8. A 70-year-old woman presents to the emergency department complaining of 1 week history of a painful swollen calf, nausea, and she says ants on her arm. She is noted to be unsteady on her feet and cannot remember what medications she is on. Observation find her temperature is at 8.6 degrees Celsius, was saturating at 98%. The blood pressure at that time was 90 out of 60 millimeters of mercury. Her heart rate was 90 beats per minute, and the respiratory rate was 20 breaths per minute. What is the most likely cause of her hypotension? A, hypovolemia. B, myocardial infarction. C, pulmonary embolus. D, sepsis. And E, anaphylaxis.
Pulmonary embolism. Option C.
C for cat is not a correct answer. The answer is sepsis. Number 18. The presence of hemianesthesia, hemianopia, and sensory hemiataxia suggests damage to the following. A, internal capsule. B, thalamus opticus. C, spinal cord. D, black substance. What is your answer?
Option A.
Option A for apple is not the correct answer. The answer is thalamus opticus. Thank you so much, members. Members, you're given just 1 minute to choose questions.
19,
19,
9,
9,
14,
14,
20.
20. Thank you so much. Can you confirm that these are your questions? 19, 9, 14, and 20? We are starting with question 19. Subacute combined generation of the spinal cord is caused by?
B for boy.
The answer is correct. So the answer is cobalamin deficiency. I know why. Let us go to number 9. A 28-year-old man presents to emergency department following his return from a holiday in the United States. A few days previously, he had noticed some swelling of his left leg and noticed that he has developed weakness of the right hand side of his body. The question, which of the following would be used to confirm the underlying cardiological diagnosis in this patient? A, ECG for electrocardiogram. B, chest x-ray. C, carotid Doppler. D, transesophageal echocardiogram. And E, ventilation perfusion scan.
C for cat.
C for cat is not a correct answer. You do a TTA. Number 14. Number 14. A glove and stocking pattern of sensory disturbance which shall develop with disease in a glove and stocking pattern of sensory disturbance which shall develop with disease in A, peripheral nerves, B, spinal cord, C, brainstem, D, the thalamus.
A for apple.
A for apple is the correct answer. Question 20. The following are features of low motor neuron lesion except
D for dog.
E for dog. D for dog. The correct answer. Thank you so much, members. Can I welcome Group C? Group C, can you please in 1 minute give me your questions?
One,
1,
three,
3,
7,
7,
and 11.
11. Can you confirm 1, 3, 7, and 11 are your questions?
Sure.
We are starting with number 11. Number 1. Question number 1. A patient attends the neurology clinic following a referral from the medical officer due to difficulty with eating and chewing food. A neurologist performs a cranial nerve assessment and suspects a lesion of the right-sided trigeminal nerve. Which of the following is a clinical feature of trigeminal nerve palsy? A, paralysis of the right bathnator muscle. B, hyperacusis. C, loss of taste in the anterior two sides of the tongue. D, loss of taste in the posterior side of the tongue. And E, bite weakness.
E for elephant.
E for elephant is the correct answer. Question number 3. An 18-year-old man has numerous inflamed open comedones on his face, chest, and the neck due to acne vulgaris. Which microorganism produces inflammatory fatty acids by degrading sebum in cases of acne vulgaris? A, Staphylococcus aureus. B, Propionibacterium acnes. C, poxvirus. D, papillomavirus. And E, Malassezia fafa.
B for boy.
B for ball is the correct answer. Question number, have they finished 7? Question number 7. Question number 7. A 60-year-old woman presents to you complaining of chest pain and difficulty in breathing when climbing upstairs. She is otherwise well. On examination, she has a slow rising pulse. Her blood pressure is 130/100 millimeters of mercury, and you hear a murmur on auscultation. Question: which of the following best describes the likely murmur heard in this patient? A, ejection systolic murmur. B, the pansystolic murmur. C, mid-diastolic murmur. D, early diastolic murmur. And E, a continuous murmur.
A for apple.
A for apple is the correct answer. Last question. That is question 11. A 29-year-old woman presents with severe epigastric pain, tachycardia, and ecchymosis in the left and the right flanks. She has the past history of gallstones. What is the most likely diagnosis for this patient? A, cholangitis. B, gastrointestinal stromal tumor. C, hemorrhagic pancreatitis. D, pancreatic cancer. And E, peptic ulcer disease.
C for cat.
C for cat is the correct answer. Group D, kindly step forward. Kindly, in 1 minute, can you give us the questions?
Two.
15. 15.
19.
19.
10.
10. Can you confirm 2, 15, 19, and 10 are your questions?
Yes, sir.
Question number 2. Yeah, that is true. Group B did number 19. That is very true.
Okay, 12.
12? Yes, was not done. Okay, so group D, you'll be your questions will be 2, 15, 10, and 12. Number 2. A 25-year-old man presents with syncope, which was preceded by palpitations. He has no history. He has no past medical history, and is generally fit and well. However, the ECG shows a positive delta wave, especially in V1. Which of the following is the most likely diagnosis? A, atrioventricular septal defect. B, Brugada syndrome. C, Down syndrome. D, tetralogy-Fallot. E, Wolff-Parkinson-White syndrome, also called WPW.
E it is.
E for an egg?
Yes, please.
That is the correct answer. Question number 15. It is called the triangle of safety. The triangle of safety is bordered by A, lateral border of the pectoralis major anteriorly, lateral border of latissimus dorsi posteriorly, and inferiorly by horizontal line from the nipple, commonly the fifth intercostal space. B, the medial border of the pectoralis major anteriorly, lateral border of the latissimus dorsi posteriorly, and inferior by horizontal line from the nipple, commonly the fifth intercostal space. C, anterior axillary line, laterally, lateral border of the latissimus dorsi, posteriorly and inferiorly by horizontal line from the nipple, commonly at the fifth intercostal space. D, none of the above. Which one is the correct answer?
Okay, D.
D for dog. That is not the correct answer. It is A. Number 10. A 40-year-old man has been admitted to hospital for pain management. The patient has metastatic lung cancer and is undergoing palliative radiotherapy. He received his last dose of analgesia just 3 hours ago. On inspection, the patient is obtunded and has constricted pupils and a respiratory rate of 8 breaths per minute. Which analgesia is a patient most likely to have received to cause the adverse reaction? A, amitriptyline. B, phenobarbital. C, IV diazepam. D, IV haloperidol. And E, IV morphine.
E.
E for an egg.
Yes.
That's the correct answer. Number 12. A 36-year-old woman presents to emergency department. She's confused and complains of blood vision and palpitations. This has happened on a number of occasions in the past. She has put on weight and is currently being investigated for collapsing twice at work. What is the most likely diagnosis for this patient? A, cholangitis. B, gastrointestinal stromal tumor. C, hemorrhagic pancreatitis. D, insulinoma. And E, pancreatic cancer.
D.
D for death. Congratulations, that's the correct answer. Thank you so much. Yeah, that is done. So I think we can go to another. We are now looking for graduates and the undergraduates of Dr. Muzei. So we are going to start with B. So we shall be choosing three questions. Yeah, because we are time bound. So this time we are going to start with the B, followed by C, followed by D, followed by A. So
20. Do they reach 20?
So B, you said 20?
Are they 20?
Yes, there are 20 questions. So you can just choose 3.
19.
19.
11.
11. You said what?
20, 19, 11.
Okay. So we are going to, can you confirm 2019 11 as your question? Okay, we are going to start with number 20. Which of the following is the most common form of congenital infections? A, cytomegalovirus. B, rubella. C, herpes virus. D, syphilis. And E, toxoplasma.
D for dog.
D for dog is not the correct answer. The correct answer is cytomegalovirus. Question 19. A 10-month-old infant develops septic shock after receiving IV boluses of normal saline up to 80 ml per kg and dopamine IV infusion is still tachypnic with capillary fill time of 4 seconds and urine output less than 1 ml per kg per hour. Of the following, the most appropriate next step for this child is A, IV hydrocortisone, B, blood transfusion, C, Milron infusion, D, start activated protein concentrate, and E, start ECMO. Group B. Number 11. That is your last question. Antimicrobial agents are indicated for treatment of which of the following diarrheal illnesses? A. E-tech, E. coli. B. Strongyloidosis. C. Rotavirus. And D. Shigellosis.
D for dog.
D for dog is the correct answer. Group C, can you kindly step forward? Kindly give us your questions.
5,
5,
9,
9,
and 13.
and 13. Can you confirm 5, 9, and 13 as the questions?
Absolutely.
We are starting with number 5. A 6-year-old girl lives in a refugee camp, brought to you with tingling and paresthesia of the feet. She has decreased deep tendon reflexes, loss of vibration sense, and hoarseness of voice, with the ptosis of the eyelids. The chest X-ray shows cardiomegaly. They were eating a polished rice-based monotonous diet for about 3 months. For the last 3 months. Of the following, the most likely cause of these findings is A. Vitamin B12 deficiency. B. Thiamine deficiency. C. Horner syndrome. D. Degenerative brain disease. And F. Guillain-Barré syndrome.
B for boy.
B for boy is the correct answer. Number 9. The main feature of hypersplenism is A. Jaundice, B. Ascites, C. Pancytopenia, D. Collateral blood vessels.
C for cat.
C is the correct answer. Number 13. 18-hour-old newborn with normal vaginal delivery without any complication, admitted to NICU with repeated apneic attacks and hypotonia with history of severe maternal preeclampsia, treated with IV magnesium and hydralazine. On examination, the child was floppy, the newborn was floppy, decreased deep tendon reflexes and hypotension. ECG shows prolonged PR interval, the QRS complex and QT interval. Of the following, the most likely diagnosis is A. Perinatal asphyxia, B. Early onset sepsis, C. Hypermagnesemia, D. Hypocalcemia, and D. Wadnig-Hoffman syndrome.
C for cat.
C for cat. C for cat is the correct answer. Group D, step forward.
One,
1,
3,
3,
and 8.
and 8. Can you confirm 1, 3, and 8 as the questions? Question number 1. What is the leading cause of worldwide under 5 mortality rate? A. Preterm birth complications. B. Pneumonia. C. Diarrheal diseases. And D. Malaria.
C.
C for diarrheal conditions, not a correct answer. The correct answer is the preterm birth complications. Number 3. A 12-year-old obese boy presents with loud, frequent, and disruptive snoring, restless sleep with nocturnal diaphoresis. He is mouth breather with hyponasal speech and morning headache. Oral pharyngeal examination revealed enlarged tonsils. Of the following, the first line treatment of this boy is A, watchful waiting, B, weight reduction, C, positional therapy, D, continuous positive airway pressure, and E, adenotonsillectomy.
Let us go E.
E for egg?
Yes.
E for egg is the correct answer. Number 8. The following diseases are inherited as autosomal dominant except A, Marfan syndrome, B, Haller syndrome, C, achondroplasia, and D, Bonneville's disease.
Let us go B. B for Barbie.
B for Barbie is the correct answer. Congratulations. Can we have group A? Step forward, please. Please choose your questions.
Six.
Question 6.
12 and 18.
6, 12, and 18. We start with 6. Which of the following micronutrient deficiencies are associated with microcytic anemia? A, chromium, B, copper, C, molybdenum, D, selenium, and E, iodine.
B for boy.
B for? For both. For boy. B for boy is the correct answer. Number 18. A 3-year-old girl presents to the emergency department 2 hours after ingestion of 1 tablet of a medication prescribed for her brother to control his drug craving. She is in coma with pupils reacting to light but moderately constricted. The heart rate was at 70 beats per minute, respiratory rate 8 beats per minute, respiratory rate 8 breaths per minute, Temperatures were 35 degrees Celsius and SpO2 was saturating at 89%. Of the following, the most appropriate treatment is A, administration of activated charcoal, B, IV flumazenil and treating according to response, C, starting IV naloxone therapy, D, supportive care and request for toxicological screen, and E, hemodialysis.
B for boy.
B for boss is not the correct answer. The correct answer is C. You start IV naloxone therapy. Thank you so much. So the next is surgery. Again, and I'm starting with D. So we are going to start with the D, followed by C, followed by B, followed by A. So group D, kindly step forward. and come with your questions from number 1 up to number 20. Please, up to 25, sorry. Here you'll choose 3 questions. Surgery. Please choose from number 1 up to 25. Choose 3 questions only. Let us know your questions.
Surgery it is.
Yes.
8,
8,
15,
15,
and 1.
1. 8, 15, and 1. We are starting with 8 immediately. Question number 8. A 65-year-old female presents with a painless lump in her left breast. On examination, a firm non-mobile mass is palpable in the upper outer quadrant. Mammography reveals regular borders and microcalcifications. What is the most likely diagnosis? A, fibroadenoma. B, breast cancer, breast cyst, C, ductal carcinoma in situ. And D, intraductal papilloma.
C for Chad.
C for church, the correct answer. Number 15. A 35-year-old male presents with a sudden onset of severe abdominal pain and vomiting. Physical examination reveals a distended tympanic abdomen with absent bowel sounds. Imaging reveals evidence of bowel obstruction with dilated loops of small bowel. What is the most likely cause of the obstruction? A, could be a colonic volvulus. B, interception. C, small bowel obstruction due to adhesions. D, large bowel obstruction due to a tumor.
C it is.
C for?
C for Chad.
C for church is the correct answer. Number one. What is the immediate management of a traumatic perforation of the tympanic membrane? A, administer oral antibiotics. B, refer to the audiologist. C, keep the ear dry. D, perform myringotomy. E, ear syringing.
Let us go C.
C for?
Cow.
C for cow is the correct answer. Thank you. May I welcome Group C to the podium? Kindly declare your questions.
3.
Pardon?
3.
3,
6.
6,
And 12.
and 12. We go immediately to 3. A blue drum is seen in A, cochlear otosclerosis. B, presbycusis. C, vestibular schwannoma. D, high jugular bulb. And E, in glue ear.
A for apple.
A for apple is not the correct answer. It is a high jugular bulb. Question number 6. Indications for tracheostomy. Indications of tracheostomy. A, in all cases of acute laryngitis. B, in any intubated patient within 3 days. C, unilateral or anal atresia. D, in case of Rodriguez angina. And E, if there is suspicion of laryngomalacia.
B for boy.
D for boy is the correct answer. What did you say? Excuse me? D.
What did you hear?
You say D for boy. It's not the correct answer. The correct answer is D for dog.
You just said for boy, but it was a D.
Members, this is the thing. The members mentioned the D for boy.
Excuse me, moderator. We say D. We could be petty about this, or we could go on. What time bad?
Give us another.
Where are my co-moderators? Remember, this is controversial because the sound of the word can easily be changed by the... Anonymous decision, we shall choose another question. Please kindly choose another question.
Question 17.
17. A 65-year-old man is evaluated for a 3-month history of persistent left lower facial pain in the mandibular region that has worsened and been unresponsive to treatment with paracetamol 4 grams 4 times daily over the past 3 weeks. It describes the pain as electrical in nature, often triggered by dental manipulation or extreme temperature exposure. His dentist found no oral or dental cause for the pain, but treated him with a 14-day course of amoxicillin and presumptive sinusitis without any improvement. The physical examination revealed, including a complete neurological evaluation, is normal. Laboratory studies and CT of the sinuses are also normal. Which of the following is the best cost-effective and efficacious treatment for this patient? A, narcotic analgesic. C, TCS. C, NSAIDs like ibuprofen. D, carbamazepine. And E, gabapentin.
D for dog.
D for dog is the correct answer. Number 12. Which of the following anesthetic gases is not suitable for induction in children? A, ether. B, sevoflurane. C, isoflurane. And D, halothane. B, D for dog, eh? D for dog is not the correct answer. It is A. Thank you, members. I welcome Group B to the stage. Kindly reveal for us your questions.
20,
20,
21,
21,
24.
24. We are starting with 20 immediately. Question 20. A 56-year-old man presents with a history of headache. He is noted to have a loud second heart sound on auscultation. Which of the following pathologies could explain this finding? A, aortic incompetence. B, essential hypertension. C, mechanical mitral valve replacement. D, mitral incompetence. And E, postural hypotension.
B for boy.
Pardon?
B for boy.
B for boy. That is the correct answer. Question 21. Which of the following is the cause of dilated cardiomyopathy? A high cholesterol diet, that is A. B, heavy alcohol consumption. C, mutation in cardiac sodium channel gene. P, obesity. E, recreational cannabis use.
B for boy.
Correct. Number 24. The following type of bands carries the highest risk of compartment syndrome. A, circumferential full thickness open flame bands. B, electrical bands. C, radiation bands. And D, facial bands.
B for boy.
Pardon?
B for boy.
B for boy is the correct answer. Congratulations. Can we have Group A come in? Kindly reveal your questions. We have up to 25 questions.
Thirteen, 19, 22.
13, 19, then 22. Okay. Let us begin with 13. Which of the following gases is most metabolized following inhalation during a routine anesthetic? A, isoflurane. B, halothane. C, sevoflurane. And D, desflurane.
C for cat.
C for cat is not the correct answer. It is halothane B. Number 19. In relation to injection of a toxic substance, which of the following characteristics make a substance less appropriate for removal by hemodialysis? A, large volume of distribution. B, long half-life. C, low molecular weight. D, non-polar molecule. E, not bound to activated charcoal.
A for apple.
A for apple. A for apple? Correct, that's the correct answer. Thank you. 22. That's the last one. A 35-year-old HIV positive man presents with diarrhea of 4 weeks duration, accompanied by tenesmus. Blood and mucus is present in the stool and is not on antiretroviral therapy. His CD4 count is 17 cells per millimeter per cubic millimeters. Which of the following is the most likely diagnosis? A. Cryptoporidiosis. C. Cystoisosporiasis. C. Cytomegalovirus coelitis. D. Gardiasis. And D. E. Microporidiosis.
C for cat.
C for cat is the correct answer. Congratulations. So the next we are going to have question number 1 of pediatrics. Huh? What is the answer? So the next, we are going to start with B, no? C. We are going to start with C, followed by D, followed by A, followed by B. So, OBGY, Group C, can you kindly step forward? And from number 1 up to 28. Can you choose 4 questions? 3 questions, sorry, 3.
3 questions. 2.
2.
12.
12.
And 24.
24. C is 2, 12, and 24.
Yeah.
Yeah, obs and gain. Question number 2. All are causes of recurrent pregnancy loss except A, PCOS, B, diabetes, C, thyroid dysfunction, and D, anemia.
Dog.
D for?
D for dog.
D for dog is the correct answer. Number 12. Asherman syndrome presents as A, amenorrhea, B, infertility, C, recurrent abortions, and D, all the above.
D for dog.
D for dog is the correct answer. Number 24. Which of the following is true in erectile dysfunction? A, there is no role of checking serum glucose and lipid profile in emergency department investigations. B, the PDE5 inhibitors can be given safely with nitrate medications. C, if a man experiences nocturnal penile erection but cannot achieve erection for intercourse, is likely to have a psychogenic erectile dysfunction. D, afferent information travels from the penile ischio-cavernous and bulbo-cavernous muscles to on-off nucleus, that is S2 to S4. E, the dorsal penile and pudendal nerves carry the efferent fibers to the spinal cord at S2 to S4 level.
C for cat.
Pardon? C for cat?
Yes.
Correct. Group D, step forward. For members who are asking whether that question was for OBGY, yes, it is. For those ones who are in fifth year, you're studying right now what we call infertility. In infertility, you evaluate both partners. So that's why it becomes an OBGY question. So
8,
8,
3,
3,
and 15.
and 15.
Yes.
8, 3, and 15. We are starting with 8 immediately. The best time to listen to the fetal heart in labor is A, before a contraction, B, during a contraction, C, after a contraction, D, all the above, E, either B, that is during contraction, or C, after contraction.
E for egg.
E for an egg is not a correct answer. The correct answer is after a contraction. That's when you do fetal heart listening. Number 15. Ultrasound features suggestive of a cervical incompetence include A, cervical length less than 3 centimeters, B, internal os width is 1.5 centimeter, C, bulging membranes into the internal os, and D, all the above.
D for dog.
D for dog is the correct answer. I think you did not answer question 3.
Yes. Question 3.
Question 3. Two definitions of abortion include except. Two definitions of abortion include except. Two definitions of abortion include except A, when there is heavy bleeding but the fetus is still alive, this is termed a threatened abortion. B, in the presence of bleeding with an open os, abortion is inevitable. C, abortion is complete once all tissue has been passed and the os has closed once more. D, endometritis as a result of infected products of conception may be termed as septic abortion. E, missed abortion occurs when the uterus is smaller than expected from the date and the os is closed. There may or may not be bleeding.
D for dog.
D for dog is the correct answer. Pardon? D for dog? Pardon your answer?
D for dog.
Oh, sorry. D for dog is not the correct answer. The correct answer is E. Missed abortion occurs when the uterus is smaller than expected date from the date so the os is closed. There may or may not be bleeding. A, can you get forward? Please, can you confirm give us your
26.
question? 26,
17,
17,
5.
5. Let us begin with 26. Which one of the terms below is used to describe a low sperm count? A, athenosospania, panspermia. B, oligospermia. D, teratospermia. And D, azoospermia. That is what?
B for boy.
B is the correct. Yeah, the correct answer. It's on pressure. Number 17. Antibodies tested for diagnosing antiphospholipid syndrome include all except A, anticardiolipin antibody, B, lupus anticoagulant, C, anti-beta 2 glycoprotein, and D, maternal antiplatelet leukocyte antibodies.
B for boy.
D for? B for boy is not the correct answer. The correct answer is D for dog. That's maternal antiplatelet leukocyte antibodies. Number 5. Regarding missed abortion, all the following are correct except A. A patient may present with loss of symptoms of pregnancy. B. Vaginal bleeding may be one of the presenting symptoms. C. Immediate evacuation should be done once the diagnosis is made. D. Disseminated intravascular coagulation, DIC, may occur as a sequel of missed abortion. E. Ultrasound scan should be done to confirm the diagnosis.
C for cat.
C for cat is the correct answer. Thank you. Can we have B finally?
D.
Can you read out your questions?
Number 28.
Number 28.
Number 9.
Number 9.
Number 1.
Hmm?
Number 1.
Number 28, 9, and 1 are the questions. Let us start with 28. Kindly choose another question. There is no question here. Okay. Let us go to number 9. The following are symptoms of pregnancy except A, amenorrhea, B, bleeding, C, urinary frequency, D, nausea and vomiting, E, breast tenderness.
B for boy.
B for boy is the correct answer. Number 1. Which of the following are true regarding estimation stroke calculation of gestational age? A, a woman's gestation is 2 weeks more than the time period since conception. B, in Uganda, remember there's an issue with this question. Can we please choose more 2 questions?
You have to give us time, right? Think about it.
It's okay. You have 2 minutes. 1 minute to think.
Number 10 and number 16.
Number 10
and 16.
and 16. Let us begin with number 10. The uterine anomaly most commonly implicated in the etiology of recurrent abortion is A, septate uterus, B, unicornate uterus, C, uterus didelphys, D, aquate uterus.
A for apple.
A for apple is the correct answer. Question 16. Clinical criteria for diagnosis of antiphospholipid syndrome include all except A, history of vascular thrombosis, B, 3 or more consecutive abortions of less than 10 weeks, C, deaths of congenital malformed fetus greater than 10 weeks, D, premature births at less than 34 weeks due to severe preeclampsia or placental insufficiency.
C for cat.
C for cat is the correct answer. So, yeah. Thank you so much, members, from this part of. There is a complaint, yes, for pediatrics. Can you confirm that is worldwide? Under 5 worldwide. Please, we want evidence from World Health Organization.
We are going to proceed to general knowledge as we confirm that. Yes, thank you so much. So let's have the general. Yes, as she comes, let the score recorder update you.
Yes, for clinicals, I'm starting with D. You add 15 plus 10 plus 5 plus 15, with total to 45. For C, you had 20 plus 15 plus 15 plus 1, with total to 55. I mean plus 5, sorry. Then for B, you had 15 plus 5 plus 15 plus 15, with total to 50. Then for A, you had 5 plus 10 plus 10 plus 10, with total to 35. Thank you. And the full total. For C, you have 165. For D, you have 140. A, you have 165. For B, you had 160. Thank you. So, A, you have 165. B, you have 160. C, you have 165. And D, you have 140. For B,
Yes, thank you very much. General knowledge, Group A. Group A. 3 questions in 30 seconds. 30 seconds, members.
For those ones who are trying to prove, for pediatrics, World Health Organization 2022 review, the most common causes of death under 5. Number 1, preterm complications. 2, pneumonia. 3, birth asphyxia. Number 5, followed by diarrhea and malaria. So Diarrhea is number 4 in the list among the most common cause of death under 5.
I think share the link in Sun Students. Yes.
9, 15, 25.
9, 15, 25. Number 9. Who is the interim executive director of KCCA?
Mary Chitaka.
Is that your final answer? Okay, that's wrong. Frank Rusa. Number 15. Which telecommunication company recently registered to start selling part of its shares of the Uganda Securities Exchange? Which telecommunication company recently registered to start selling part of its shares of the Uganda Securities Exchange? Yes? It's Airtel. Number 25. That's wrong. They have failed it. Number 25. Which club has won the most titles in the Uganda Premier League? Yes? Is that your final answer? Okay. That's wrong. SC Villa is the answer. Next group, Group B. They have failed all of them. Yes, concern, approach the desk very fast. Group B, select your questions. Yes. Yes. Okay. I'm going to correct.
We pardon on the questions these guys asked. We are sorry, we were
9, 15, and 25.
okay. 5, 7, 18.
5, 7, 18. So, number 5. Who is the Prime Minister of Busoga Kingdom?
That question is biased. It's a biased question. It's not general knowledge.
You can say pass, like if you don't have an answer, so that you don't wait for the 30 seconds.
It's okay.
Joseph Muvawala.
Did you know the answer?
The next question is question 7. Who is the editor-in-chief of Vision Group?
We passed.
Okay, thank you very much. It is Barbara Kaija.
Did you know him?
Then the last one, question 18. In which year was the current constitution of Uganda formulated? Select your questions.
1995.
That's right.
But I suggest you ask questions which make sense. Prime Minister of Busoga. I'm not a Musoga to know the Prime Minister of Busoga. It's not fair, really. I blame you for that.
Put back the mic where it is supposed to be.
Excuse me. I get that you're not a Musoga, but this is general knowledge. You need to know the things.
Let the modulators first come. There's some form of misconduct here. Modulators, approach the table.
Members of Group B, that's misconduct, and it's the last warning, please.
Kale, that's the last warning. Your questions?
3, 21,
21,
and 6.
And 6. Question 3. Who is the CEO of MTN Uganda?
She's called Silvia. I've forgotten the other name, but she's from South Africa and she's called Silvia. I've just forgotten the other name. No. Okay, what? Since they didn't say full name of the CEO, I've said the name of the CEO. Yes. They did not say full name. They said who is the CEO, and the CEO is Silvia. Oh.
There are very many Slavias that exist.
I specified.
There is no one who has only one name. It's supposed to be 2 at least. Yes. Next question.
Okay. Your next question was.
Excuse me, moderator. Sincerely, it's not okay if we have chosen an answer with a name, and the name is a name of the person who owns it, even though the other name was not specified.
Moderators are going to discuss it. Question 21. According to the recently conducted population census, what is the population of Uganda?
$45.9.
Yes?
45.9 million.
45.9 million. That's right.
We want our answer. The other one also.
Question 6. Who is the current Miss Uganda?
She's called Natasha Nyonyo.
Pardon?
Natasha Nyonyo.
Okay, that's right. Natasha Nyonyoza.
We also want the other one also, please.
Okay, first sit. Group D. Group D. Take over. Okay, according to Group C, the question really wanted the name you get. So we really wanted 2 names. Okay? We really we apologize for that, but no point.
Our numbers.
D?
19.
19.
22.
22.
28.
28. Question 19. In which year did Uganda have 3 banks, 3 Bank of Uganda governors? No. In which year did Uganda have the Bank of Uganda governors? It is in this same year that one of Uganda's authoritarian regimes was overthrown.
Nineteen 1971.
It's 1979. That's wrong. Question 22. What is the new capital city of Burundi?
Gitenga.
Gitega, that's right. 28. Which Ugandan athlete won silver in the women's 300-meter steeplechase?
Which year?
I think let's take the recently concluded.
Which race? Because
No, the question remains as it is.
This year so far, there have been 3 races. Where, yes, 3.
There have been races, there's the World Athletics, there have been the Olympics and so on, so I don't know which one.
Okay, no, to avoid confusion. Okay, get another question. No. Members.
17. Oh, 17.
Yeah, 17 has not been. How big is Uganda's debt? You can give value or percentage to GDP.
It is, I just know. %45.
Okay, the answer is 47.9. Thank you very much. You were close. Yes, let's have math and logic.
Yes, good evening. This is the last session, Math and Logic. My name is Sempija Osama, 2.1. Let us begin with Group A. Yeah, Group C. No, this is the new pattern. C, D, A, B. Yes. And you're choosing 3 questions.
We're choosing questions 3, 6, and 8.
Let us begin with question 3. At a garage sale, all the prices of the items sold were different. If the prices of a radio sold at the garage sale was both the 15th highest price and the 20th lowest price among the prices of items sold, how many items were sold at the garage sale?
$35. 35.
No, the answer is 34. Let us go to question 6. What angle is formed by hour hand and minute hand form at 3:40 p.m.?
One 105. Sorry. 150.
150, correct. We're going to question 8. The negation of the statement, he is rich and happy, is?
He is rich and. He is rich and.
No. The answer is, he is not rich and he's not happy. The negative of that. Yes, can you give me your questions? They chose
which questions did they
3,
choose?
6, and 8.
Nine.
Yes, Kafero.
9,
9,
15,
15,
and 20.
20. We begin with question 9. Which number system is measured of time based on? Which number system is measurement of time based on?
Integers. Integers.
No. We go to question 15. Spot the odd one out. First, second, third, fourth, fifth, sixth, seventh, eighth.
First, second, third.
No. Fourth. Let us go to the next question. Number 20. Today is neither Sunday nor Wednesday. Tomorrow is not Sunday or Wednesday. Yesterday was not Friday. Monday was not the day before yesterday. Neither was Sunday. Which day of the week is today? If one of the statement is false. A, Tuesday. B, Wednesday. C, Saturday. D, Sunday. He was speaking.
Tuesday.
No. The answer is Sunday. Group B. Group B, step forward. Finally, Café Rodan, GRC Math and Logic. Yes.
23.
23.
12.
12.
9.
9. Starting with 23. The professor was driving to his way out of town, to his out of town clinic at a consistent speed, not faster than 90 kilometers per hour. At one moment, the meter showed 16961 kilometers of mileage. In exactly 2 hours, the moment on the meter once again showed a number that reads the same in both directions. At what speed in kilometers per hour was the professor driving?
Zero kilometers per hour.
No. Proceeding to number 12. Kevin, Joseph, and Nicholas are 3 brothers. If the following statements are all true, which of them is the youngest? Kevin is the oldest. Nicholas is not the oldest. Joseph is not the youngest.
Nicholas is not. Nicholas.
Yes, that's the correct answer. Question 9. Was answered. You should.
Okay. I made a mistake. Let me just change the question.
Yeah.
Yeah.
Choose another question. Question 14. A boy and a doctor were fishing. The boy is the doctor's son, but the doctor isn't the boy's father. Who is the doctor?
Fisherman.
Okay, that's not true. The answer is mother. Group A.
Yes.
You can choose your questions. To choose.
We are choosing 2, 11, and 18.
2, 11, and 18.
Yes.
Here we go.
All right.
Describe the following sequence in the mathematical terms. 144, 72, 36, 18, 9. A. Descending arithmetic sequence B, ascending arithmetic sequence. C, descending geometric sequence. D, ascending geometric sequence. E, miscellaneous sequence.
A for apple.
A for apple. That's the answer is C. That's not right. Yes, question 11. What theory maintains an idea is true if it works or settles the problem it deals with?
Try and error.
That's not true. Pragmatic theory. Question 18. How can you get the number 6 by only using 3 zeros? How can you get the number 6 by only using 3 zeros?
By adding a 6 to them.
No. By using the factorial method. Yes, I think that's it. Let me hand over to the president.
Yes, I think we've reached the beginning of the end of the second edition of Sumsa Medical Quiz. At this point, I'm going to thank everyone who has been able to stay with us till this far. Thank you so much to the participants and the team that has made this happen. I think at this point, we should give chance to the score recorder to give us clear information about what exactly we've done. Yes. We're going to be having more of this from time to time, and we shall be communicating. Allow me use this point as this time as this score recorders compile to clearly inform all of us that Soroti University has been chosen to host the 2025 National Medical Quiz. So we are going to have 12 medical schools next year, and we shall have the winners of this internal battle with the others that will be coming. So I request that as we leave this place, we continue to practice. These questions are going to be available to us, whoever needs them, so that you can continuously go through them, and maybe you can also look for errors. Yes, I think the score recorders are ready. Yes, for pediatrics, we concluded that it was wrong.
Thank you, you people, by the way, for staying this with us. All right, members, I want to congratulate all of you for managing to be with us here. From 2 up to now, it's really not an easy task. I've tried to put down our scores as per the members that were representing the respective teams, A and B, C, up to D. We were blessed that you guys all showed competence in whatever you did. We are proud of you. Whenever you go outside there and represent us, for example, in the upcoming national quiz, it being that we are the ones who are going to host, it is always good that we take it. I mean, we keep it home. Don't let it to go away. So as per the results, group, there are not of votes, of course, in order. Group A had a total of 165. Then Group B had a total of 155. Then Group C had a total of 180. And this was followed by Group D, of course they are not in order, which scored 145. Yes. So I think let me leave this to the president to give out the prize to the winners.
Yes, we already know the winner. I think I'm not in the right position to really award the winners. Yes, I'm not the best person to award the winners, and I request that we award the winners on the next grand round that we shall be having. Yes, by the people with the capability to award the winners. Yes. But allow me declare group or team C as the winner of the second edition of Soroti University Medical Student Quiz. Yes. Congratulations, congratulations. To the other teams, we are so much grateful for the energy. It was really a serious battle. Yes, it was really a serious battle. And I'm sure that we've actually picked something from this quiz. Thank you so much. And I call it an evening. The awarding will be on the next grand round that we shall be having in this very hall. Thank you so much, and the rewards will be communicated, and some are already available here. I've not specified, but the awarding will be here. Yes. So in case of any communication of a grand round, please, let's stand up and receive our rewards. Yes. But thank you so much to all of us, the team that has made this happen. We very much appreciate your efforts. I request we have at least a photo moment here. Yes, as we conclude the day. Yes.
Lydia Jasmine, yeah. ate the first born atadde wako sasoka sidde wako siringa uli budami buli kaseera bubeera fani zene saamu kumane ira kimuli kutale jagalanga weneyagala so singa kwe weweyagala matiranga wene matira so singa kwe wewe Lydia Jasmine, yeah. Attend all the first born atadde wako sasoka sidde wako siringa uli budami buli kaseera bubeera fani zene saamu kumane ira kimuli kutale jagalanga weneyagala so singa kwe weweyagala matiranga wene matira so singa kwe wewe matira